treatment, call 212 Choices. 212 Choices. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We're taking your calls. Call us if you want. 800-848-9222. 800-848-9222. We have some follow-up stories on patients that we've treated over the past, and you probably want to hear what happens to the older patients, the patients that we've had that have been coming for years or months. What happens? So first one I want to talk about is a woman from upstate. She had kidney cancer. We treated her with kidney cancer 15 years ago with stereotactic body radiosurgery. So this was a time when she was only being told she had to lose her kidney to surgery. She didn't want to lose her kidney. She didn't want to get cut. She didn't want to go to a hospital. She didn't want that. And she came to us 15 years ago. She had the confidence and trust to come to us. We treated the kidney cancer. It was non-invasive treatment, so we make a stereotactic frame for the patient. We computerize what's in her body. We find the cancer in relationship to the other tissues. And there were 5 50-minute treatments. We're going to take this call, see if we can hear. If we can hear, great. No, can't hear. So there were 5 15-minute treatments. And guess what? 15 years later, she is still in remission. The cancer is dead. She never had surgery, no chemo, no cutting, no bleeding. 5 treatments, 15 minutes each. Wow. Wow, wow, wow. And we've actually documented this. We've presented our data at major cancer meetings, both in this country and overseas. So not only were we the first in America, but we continue to present our data so that others can learn about this technology. And hopefully your doctors and you can learn about it before you get cut on, unless that's what you want. But another patient I want to report on, a woman that came last autumn with colon cancer, and she had multiple nodules of cancer wrapped around her intestines, choking her cancer. You can imagine like a fist around her intestines. These cancers were like a fist squeezing off her intestines. And she wasn't able to eat. She was vomiting. She was sick. She was in pain. I spoke to her surgeon. He says, Gil, I can't do anything. We can't cut on her. It's impossible. She refused chemo, which even if she took it, unlikely to work very well. We treated these nodules. There were multiple nodules, masses wrapped around the intestines. We were able to do that, treat them all, multiple, non-invasively with fractionated stereotactic radiosurgery. She just came for a follow-up PET scan this week, and every tumor is dead. Every tumor has stopped or shrunk. No tumor is growing. Everyone is stopped or shrunk. There's less PET activity. PET is an injection of radioactive materials. Every site shows shrinking, good response to therapy, and her pain is going away, and she's eating. She's eating solid foods and regaining what she lost while the cancer was there. So it's a great, true story this week. A woman whose bowels were blocked up by cancer. She couldn't eat. She couldn't have solids. Her surgeon wouldn't operate. The cancer was wrapped around the bowels. She was told it was untreatable. She heard about us, came in, trusted us, treated with radiosurgery, and now she's in remission. She's in remission from metastatic cancer from stereotactic radiosurgery. So people often ask us, can you treat stage 4 cancer? Obviously, the answer is yes. That's what we've been talking about. We can treat localized cancer. We can treat stage 1, stage 2, stage 3, and even stage 4 when you think there's no other options. So it's worth it to give us a call, that 212 Choices number, or best yet is to come in and we meet and we discuss all the options. And you are the President of the United States of your body, and you get to decide what happens to you. The doctors are just the advisors. You are the President of the United States of your body. So there's another case I want to talk about. This gentleman came in, he's about 50 years old, prostate cancer. He had a Gleason 6, which is how the cancer appears under the microscope, PSA 9, the blood test. He chose to be treated with our treatment in the stereotactic body frame and brachytherapy. Brachytherapy means therapy close to the cancer, where we actually just put into the cancer radioactive seeds to give a high dose of radiation to the prostate and to avoid harm to the healthy tissues. So what happens? Well, the PSA should go down quickly, and in him it went from 9 all the way down to 1 in the first follow-up, after the first treatment, without surgery, without hormones, without any medications, just with our treatment in the stereotactic frame and brachytherapy. So he was fortunate to have 9 this results with the PSA went from 9 to 1. He avoided the 9 weeks of radiation, and we know that our treatment is more successful in half the time than 9 weeks of radiation. And we know that the treatment is more successful than surgery, even though people often falsely believe that if you have surgery, it gets it all out. No, it usually gets it all spread, not gets it all out. Our data for this man with a PSA 4 to 10, if he had surgery by the chief at a big cancer hospital in New York City, his success rate would be 76% for that group, and we're at 90%, so 18% better. So it's almost expected that we'd be better, and in this gentleman, we did great results. Wish him well. And how do we follow this man? Well, we'll get PSA tests usually twice a year. He'll come in, see the results, and we'll keep moving ahead. He's fully functional, no adverse side effects, nothing down, everything's up. Another patient I want to talk about, a woman who's about 75, 80 years old, with stage 4 breast cancer, means metastatic. She had different sites in her body, including in the breast, the arm, and some bone sites, so stage 4. She's a little bit fragile. Her family does not want her to have chemo, and we know that chemo only works transiently. We gave her radiosurgery to the different sites, the breast, the lymph node, the bone. She got a follow-up this week. We staged her up, took an hour to do so. She is in complete remission, no active cancer. All the cancer sites we treated are better, nothing's worse, no side effects, no adversity, 15-minute treatments with stereotactic body radiosurgery. So beautiful results. Her sons are physicians, and they're amongst our biggest advocates because they know how other treatments go. This woman, stage 4 cancer, is in remission, like that woman with colon cancer, in remission after fractionated stereotactic radiosurgery. Fantastic results. Fantastic for her, fantastic for her family, fantastic for us, because we love when patients do well. We love it, love it, love it. Just have a few more minutes. Again, my name is Dr. Lederman. We're at Radiosurgery New York. We have a booklet DVD about brain tumors, about cancers of the body, about prostate. You can call us and get that booklet by calling us at 212-CHOICES, 212-246-4237, 212-246-4237. You can call for an appointment, which is always the best way to be seen. We're very conveniently located by most subways, trains, buses. We're at 30th and Broadway, close to Grand Central, Penn Station, PATH trains, Port Authority. We have the urgent cancer consultants where we guarantee we'll see you within one business day. If your treatment out there is not doing well, if you're not getting better, if you have pain, bleeding, suffering, you can't tolerate the other treatment, give us a call. There may be a treatment that you like a lot better. It's non-invasive, no cutting, no bleeding, and gives you what you want. So again, we want you to know there are choices, And that's why we have our phone number, which is 212-CHOICES. So give yourself the most choices. Give yourself the most choices by calling us. And again, we take most insurances, Medicare, Medicaid. I want to talk about a gentleman who's coming in, young man, sexually from Egypt, with a pituitary tumor. Pituitary is kind of the master gland. It controls many of our functions in our body. He had surgery 3 years ago, and now the tumor's come back. So he came to us for treatment. He's going to start the treatment this week. Most probably we can stop it or shrink this tumor of the pituitary gland non-invasively, without cutting, without bleeding. And again, we were the first in New York to offer fractionated stereotactic brain radiosurgery. So it's the end of the hour. Again, went fast. Thank you for your phone calls. If you have other questions, please call me during the week or during the weekend. We'll try to answer all your questions. We have another show tomorrow from 6 to 7 on station WOR at 710 on your dial. So again, thank you for calling. We wish you well. Doing the right thing is calling and asking first. So God bless you, and thank you for tuning in, and have a great weekend. Bye-bye now. It's Dr. Lederman saying God bless you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News, I'm Scott.